In central Indiana, we have seen an increase in mental illness related deaths, whether they are suicides or domestic. And this got us talking and thinking more about a lot of people there that are trying to seek help, but they might not know exactly where to turn or are afraid to. We also want to know if the experts are seeing an increase of mental distress at homes across central Indiana. We know they are, but what can we do about it? Joining me this morning is Dr. Melissa Butler. She's a psychologist with Riley Children's Hospital. We thank you so much for joining us this morning.
Good morning.
Yeah, let's talk about it and dive in here. We know that when there's a lot of different family dynamics going on during the pandemic and there's a lot of stress added, what do you want people to know?
I want people to know that help is available. We did see a decrease in kind of access to care early on during the pandemic, where many clinics and private practice offices were closed, and we're working towards opening up virtual therapy, and many of them did. So I want folks to know that there is help available out there. I also want folks to know that to not avoid going into your local emergency department if you're feeling that you're in a crisis. Just like with other non-COVID related medical emergencies, we in the mental health field worry that folks might avoid seeking help. And so we did see a little bit of decline early on in our emergency room visits. So again, help is available.
I want to talk to a little bit about child abuse reports. A lot of times those that go up at different times of the year. With the pandemic, people were afraid that maybe with school not in session and kids being at home more, there wouldn't be maybe the opportunity to see that. What are you seeing when it comes to those kind of numbers and reports and maybe see the need for help?
I think nationwide, many states have reported, but I know New York saw a 50% decline in child abuse reports being made for a time. So that is a worry that people aren't, the caregivers like teachers who might report or notice symptoms aren't seeing children face to face, so aren't able to kind of recognize symptoms and report these. So I think that is a concern. One that we're watched on.
Melissa, we have about 30 seconds left. I didn't mean to interrupt you. Sometimes it's hard when you think someone's finished with their sentence. But
Sure.
Where we talk about people getting help, get help. What is the easiest or maybe even the most efficient way to actually be able to do that?
First, if they have a private insurance, call their insurance company, find who their providers are. There are local community mental health centers. Look those up in their area. That would be the greatest place to start.
Dr. Melissa Butler with Riley Children's Health, we sure do appreciate it. And again, just having that topic and talking about it and reminding people that, again, it is okay to ask for help. Thank you so much.